Good morning again. I'm just gonna try and carry on my videos about prostate cancer. Again, I'd like to just start that I'm not a doctor. I'm not any way medically trained. These are facts that I've picked up from the internet, mainly from prostate.co.uk, which is the main charity within the UK which we live. And I've tried to put everything together in like a little fact file, and so you go from there. So based in the UK, so a lot of these may just be just to the UK. The prostate cancer is the most common cancer in men. 1 in 8 will get it within their lifetime, and caught early, the prostate cancer has a very, very high survival rate. It's said that 99%, if caught early, people will survive. 74% of men cannot correctly identify actually what the prostate does. It's a male reproductive sexual gland. It's the shape and the size of a walnut, and it sits underneath the bladder. Its main job is to help make semen, which is the fluid that carries the sperm. 1 in 6 men from the African Caribbean origin are at risk, which is more than the normal white person. In the UK, 12,000 deaths a year are from prostate cancer. If anybody wants to speak to people professionally about this, please log on and get in contact with the prostate.co.uk or the Macmillan nurses. They're all very trained to speak about this, where personally I'm not, and I have rung them a few times while I was going through my journey, and they helped me a lot with a lot of good information and good links, what to do. Again, if you don't know me, you're just coming to this video, my name's Neil Davidson, 52, from the UK, from Norwich, and diagnosed back in December with prostate cancer. I had 5 out of 16 tumours which were found. 4 of them were 3+4s and 1 was a 4+3. Again, at 52 years old, I'd hoped that I'd caught early. I didn't have hardly any symptoms. It was a random blood test I had whilst on holiday in Latvia last August. I've had the prostatectomy back in April, and as I sit here now, which is the 19th of June, everything seems to be fine. Probably 100% incontinent, free from incontinence, so all seems to be good. Got one little wound which is still playing up, where the drain came out, but that's been we've got antibiotics for that, so it seems to be healing quite well. The average age that prostate cancer get caught is probably 66, and whilst I was on the ward at the Norfolk and Norwich, I was probably 20 years younger than anybody else. Again, most people who were in the ward were probably there because they had symptoms and getting treated for that. Yeah, I was the boy on the ward. Symptoms, there's such a list of symptoms which it could be. There's a lot of different pains down in that region. Sometimes you can't pee properly, sometimes you can't get an erection. There's so many different things, but my only one I had was that I did get up at 3 o'clock in the morning for a wee, but it became habit then. I woke up every morning and just decided that I would go for a wee. Sometimes I didn't bother, sometimes I did. So it's not. It is a symptom, but it's not a symptom as such. You couldn't go to the doctor and just say that I get up at 3 o'clock in the morning just for a wee, because he'd probably laugh at you. You know, yes and no. You know, 80% of the men over 40 years old would probably go for a wee. So you wouldn't go to the doctors just for a PSA test, just to say that you've been to the toilet in the morning. You're at higher risk of getting prostate cancer if your immediate father and brother has also had this. The normal steps in the UK, how I done was, I come back from Latvia after 2 blood tests. Both were 5.6 on the PSA. I had to have 2 more blood tests back in the UK. One was 6, one was 5.6. And it's only just above the 0 to 4 range. And a high reading doesn't always mean that it's cancer. I had one lady, Karen Porteous, message me to say that, you know, a high PSA doesn't always mean, it could mean a benign tumour, it could mean an enlarged prostate, it could mean an infection. So PSA is a little marker. It's not the best in the world, but it's an indication, and it's the best out there what they've got at the minute to try and test your blood. It picked mine up, and I had 2 blood tests when I come back to the UK. Again, both were slightly above. So I then got sent to the GP, who done the DRE, the digital rectal exam, which 3 or 4 seconds, he said he couldn't really feel anything, but I think they only touched the outside of it anyhow. So from then, 2 weeks later, different countries do this different, but I got sent for an MRI, and for the MRI it spotted a little couple of images which was they didn't really know what. So the last thing we normally go for is the biopsy. I know some countries do biopsy first before the MRI, but in the UK it's mainly the MRI before the biopsy. The biopsies are MRI guided. They know exactly where they're going to, and I had said 16 biopsies, and out of that 5 were detected. There's all different treatments you can have. It all depends on your situation and your age and how far it's spread. But the technology out there now is so far advanced than it was 10-15 years ago. If you're at low risk, you'll probably be offered AS, active surveillance, just basically to keep an eye on it for the next 3 months, 6 months, a year. And if anything does go up on the PSA test, then they probably will go a little bit further down the line with some treatment. If it's not, they'll just keep testing you every 6 months. Excuse me. There's a treatment called brachytherapy, which will put seeds into the prostate and just gives out a little radiation over time, and hopefully will kill the cancer within the cell, within the prostate. There's a proton radiation beam where you can go for like 30-40 sessions of that. There's cryotherapy, hormone therapy, chemotherapy, vaccines. So there's all different treatments. And I say it all depends on where you are. Mine was very early stage, and my decision to go for the prostatectomy was because of my age, and also obviously the early stage, where we found it, and also for me that I'd read if you had the radiation first and it didn't work, then you couldn't have the prostate out. Whether that's true or not, I believe it is. I don't want people correcting me, because I have read that it's harder to treat. So I thought, well, I'll have the prostate out, then you can have radiation if anything is found after that. You would normally have a 6 weeks blood test after the operation to see if there's any remaining PSA traces within the body. Luckily, touch wood, mine came back undetected, less than 0.01 undetected. So at the minute I'm going for a 6 months checkup later this year. Then if you are still clear, then you'll have another 6 months, and then they may extend it to a year. then hopefully after that you're still going to be clear, and after 5 years they can call you cured from cancer. So my advice to anybody, you've probably seen my other videos. If you haven't, please subscribe to me and look back at my journey. My journey is not everyone's journey, it's my journey, and things that happen to me might not happen to a lot of people, but it's a few tips and tricks there, some hints just to aid the recovery. So anybody, I don't mean everybody has to rush down to their doctors and get tested. There are pop-up centres come up at different car parks, at different supermarkets, and 3 in 5 men don't want to hassle their GP to get tested. But a simple blood test, it takes 5-10 seconds, and it literally could save your life. It could extend your life just for a simple blood test. Again, I didn't have any symptoms or bar get up at 3 o'clock in the morning. I didn't have no pain, I had nothing, absolutely nothing. And to be fair, if I was still in the UK, I would never have gone to the doctors and complained about going to the toilet at 3 o'clock in the morning, never. It was literally, I was in Latvia and I had a full blood test for €20 and the results in English in 3 hours on email. So that was the best €20 I'd ever spent. So any person who is watching this, so mainly from the UK, we have a charity called prostate.co.uk, which are very good. They've got so much information there. They've got trained people who can answer any question. And also we have the Macmillan nurses as well, who do a fantastic job, not only just for prostate, but just for all cancers. Again, very professional, very big company. Any person who's any questions, please give them a ring and ask away. So this comes to the end of my video. Again, if you've come here through asking about the prostate, try and look back at my other videos if you are going through the operation and just want some hints to aid your recovery. I hope, and I know it has helped people out there, because the comments I've had were absolutely mind-blowing. I'm now on 560 subscribers from original 120, and again, one of my videos, 52,000 views at the minute. So that's 52,000 people that I've tried to get the message to, and if I can save one person or help one person, help their recovery or anything, then that's my job done. So consider subscribing, it doesn't cost anything. Hit the bell for notifications. And again, I'm going to try and do a few more little videos about the prostate. I'm very passionate about it, and I want to try and get out there to as many people as I can. And yeah, thank you very much. I'll see you soon.